Hello, my name is Savannah Smith, and today I will be describing rotator cuff tendonitis through the SOAP process. Rotator cuff tendonitis is described as a group of muscles and tendons attached to the bone of the shoulder joint that can become inflamed. This is a common injury archery players can suffer from. To begin, my patient is an older male experiencing pain in his right shoulder and upper arm. He reports pain as a 7 out of 10 when using the right arm for archery and a 5 out of 10 when performing regular activities, especially lifting the right arm. In the past, the patient has had a few injuries to the shoulder due to archery, but none have been severe. The pain began approximately 3 weeks ago, and the patient has been using over-the-counter pain medication and ice packs. The patient is TTP over the right shoulder in the area of the rotator cuff. In an active range of motion test, there was a 5 out of 10 P with shoulder abduction and 2 out of 10 P with shoulder adduction. The results are the same with the passive range of motion assessment. The patient performed the aptly scratch test, which showed weakness in abduction and external rotation in the right shoulder compared to the left shoulder. The patient also performed the drop arm test, which thankfully ruled out there being a chance the patient had a rotator cuff tear. I assessed my patient was suffering from a rotator cuff injury. A DD is rotator cuff tear. My plan for my patient is a 4-week treatment plan that is expected to ensure the healing process so it goes smoothly and so the injury does not continue. The patient will have at-home treatments and therapy treatment that can and also should be done at home. And the PT will perform a circuit of 3 where exercises, strength and activities, and stretches will be included in each set. The at-home treatments are using ice packs for 20 minutes, 3 to 4 times a day, and then decreasing to 2 times a day throughout the weeks. Then using over-the-counter pain medication like ibuprofen to ease swelling and pain. Lastly, halting archery activities for the time being will quicken the healing process. My patient will also be doing exercises, strengthening activities, and stretches to help this injury. The first exercise is the pendulum swing, where you lean over, bending at the hips, and use a tabletop for support. Then you use a lightweight object to perform easy movements, where you swing the arm and a little bit of your body in a circular back and forth and side to side. Execute this for 1 minute within the 3 circuits. A second exercise is the weight exercise. Lying down on the hurt side, use a small weight, put the elbow in front of your body and straight out in front of you. Pull the arm up and slowly come back down. Do 10 times each circuit of 3. On the side and bottom of each slide will be pictures depicting what I'm describing and a link to the actual video. A strengthening exercise is the resistant band rows. Sitting down, wrap the band around the feet and grab the band. Put thumbs up and put wrists in a neutral position. Then pull the band and squeeze the shoulders, then slowly bring them back down. Perform 10 each circuit of 3. A stretch is the PVC pipe stretch. Sitting on the ground and using the PVC pipe, use one arm to put the pipe behind the back and the other arm to grab the bottom of the pipe. Then slowly pull the pipe up with the arm holding the top of the pipe, then hold this for 30 seconds and repeat 3 times. The second stretch is the external PVC stretch. Lying on the ground and using the PVC pipe, move the elbows out and push both arms behind the body, touching the ground. Then come back up, hold for 10 seconds, and perform 10 times. Repeat for each 3 circuit. A third stretch is the external resistant band stretch. Using a resistant band, grab the band with 2 hands and put both thumbs facing up. Put the wrists in a neutral position and keep the elbows by the sides of the body. Pull the band out and slowly pull back in. Do 10 times for 3 circuits. Thank you for watching my discussion video on a rotator cuff injury and the SOAP process.